So let's go back to the sympathetic nervous system. You can guess what's happening to this guy's organ functions while he is undergoing his adrenaline rush. I'll give you a hint. The running is voluntary, kind of, but everything else that we're going to talk about is going on automatically without his control. So when we talk about the adrenaline rush system, we're essentially talking about the effects of epinephrine, adrenaline. So what are one of the effects of epinephrine, adrenaline? Well, this causes the heart to pound. That's called palpitations. When you feel your heart beating in your chest with a lot of force, we call those palpitations. And so here the effect of adrenaline is reflected by the heart pounding. So there are adrenergic receptors on the heart that sense that epinephrine, sense the sympathetic nervous system. So the heart receives a neuron from the sympathetic nervous system, and that neuron has norepinephrine, mostly. The heart can also sense adrenaline coming from the adrenal gland. Notice that adrenal word. The adrenal medulla puts epinephrine in the blood to put everything on overdrive. And it's beta-1 receptors on the heart that sense the norepinephrine and the epinephrine. And so we'll call them adrenergic beta-1 receptors. Adrenergic as in the adrenaline system. One of the effects of epinephrine adrenaline is to raise blood pressure. And it does that by causing systemic blood vessels to constrict. When we take a blood vessel and make it narrow, that raises blood pressure. So adrenaline raises blood pressure by causing vasoconstrictions. The blood vessels of our body are innervated by a sympathetic neuron, and that sympathetic neuron secretes norepinephrine onto the smooth muscles, and those receptors cause those smooth muscles around the blood vessels to constrict, causing vasoconstriction. Receptors can also sense the adrenaline coming from the adrenal gland, and those receptors on the blood vessel are called alpha-1 receptors, adrenergic alpha-1 receptors. One of the effects of epinephrine, adrenaline, is to open the lung airways. Because he's running away, he doesn't need filtration, he doesn't need wet lungs filtering the dirt. He needs maximum ventilation, and so because of the epinephrine, the adrenaline, the sympathetic nervous system is causing the lung airways to be wide open. So one of the effects of epinephrine adrenaline is to open lung airways, relax the smooth muscle around the bronchioles so they can open up. So the lung bronchial smooth muscle is innervated by a sympathetic neuron, and that sympathetic neuron uses norepinephrine. The lung bronchiole can also sense adrenaline coming from the adrenal gland, that's epinephrine, and the lungs use something called beta-2 receptors, adrenergic beta-2 receptors that sense the epinephrine and norepinephrine to cause bronchodilation. Another effect of the epinephrine adrenaline on this gentleman is to cause the blood to his muscles to be increased. When he is exerting himself this way, using a lot of oxygen and energy to run really quickly, we need to get more blood to his muscles. And the way that happens is to shut down blood supply to the gastrointestinal tract. So one of the effects of epinephrine adrenaline is to stop blood flow through the gastrointestinal tract. Something else that is an effect of the epinephrine adrenaline is pupil dilation. That's called mydriasis. And so his pupils are being dilated because while he's running around, he needs to be able to take in light and see. Maybe he can find some cave to hide in. So why are all these changes occurring? They're occurring because of the sympathetic nervous system, which has neurons that lead to these organs and use norepinephrine as a neurotransmitter. The adrenal gland puts adrenaline into the blood to give all of these effects an extra boost. And we'll call those adrenergic neurons coming from the sympathetic nervous system, and we'll call this the adrenergic system. The adrenergic system is all about the adrenal medulla that secretes epinephrine and the sympathetic nervous system. And so you'll hear The sympathomimetic drugs, also referred to as adrenergic drugs. So adrenergic and sympathomimetic mean the same thing in this course. Adrenergic agonists are also called sympathomimetics. This is one of the confusing things for many people in pharmacology, that the same class of drug has different names depending on which publisher you read. So adrenaline, epinephrine, is our main adrenergic agonist. It increases heart rate, constricts blood vessels, therefore increasing blood pressure. Adrenaline will dilate lung airways. Adrenaline will dilate pupils. Take, for instance, albuterol. Albuterol is an adrenergic beta agonist. It's used for asthma. What are some of the effects that we can expect besides bronchodilation? Increased heart rate and increased blood pressure, and this is what I want you to be able to see from the use of sympathomimetics. Sympathomimetics will make heart rate go up and blood pressure go up and cause lung airways to be dilated and pupils to be dilated. And so, again, the point of this lecture is to understand that even though albuterol is designed for asthma, it's still going to affect many organs of the autonomic nervous system. Any drug that affects the autonomic nervous system will affect many organs. Well, we'll talk about adrenergic antagonists when we talk about high blood pressure next time. Beta blockers are common drugs used to treat high blood pressure. So beta blockers are common drugs used to treat high eye pressures as well, and that's called glaucoma. Can you see why beta blockers make asthma worse? We use a beta agonist to open lung airways. Can you see how a beta blocker used in blood pressure will close lung airways and can cause bronchospasm? And so one of the things I need you guys to be able to do is look at the warnings on these medications and understand why things like beta blockers can make asthma worse. That's why it says avoid in asthmatics and people with lung disease.